So en kainutik kuran Nicholas Mitei, ane daktari nebo surgery, senior resident in general surgery. Aboisien yuto Top Hill Hospital ako en procedures chekiaba kora ko missing ko brain and spine surgery, ako kitinye kora orthopedic procedures, kitinye general surgery procedures, choto ko surgeries chebo moet, hernias, orthopedic procedures ko chebo joints, spine ak kawek, fixation nebo kawek. Now, in Top Hill yuto ketinye machinisiek tugul chemuche keyai procedures chuto tugul, ako choto che torete kemuch keyai all these procedures. So chekiyoe en yu ko bone fixation, kou yon kail kawet ko kindo chumoyot, anan ko screws, anan ko chumoyot anan ko screws. Now, kora ketinye joint replacement procedures. Because joint replacement ko en kutungoik ak hip joints ko kimuche ke replace en chito non kikosich severe arthritis kikowechok jointit, kinyo ke replace kindo koik chumoyot. So some of the procedures chekiyoe ko choto ak spine surgeries che fall in kora en area nebo orthopedics.
Kitindoi lab nebo kisasa neimuchi kokweny mionwogik cheter ak cheter kobun korotik chekinemu en mgonjwa. Kitindoi kora pharmacy netindoi kerichek chechang cheter ak cheter kosubkei ak miondo nemara kotindoi chito. Kitindoi departments chechang en sipitalit. Netai ketindoi casualty, kitindoi theaters oeng chebo kasari. Ngiker nguno kainenyo Top Hill Hospital ketindoi motto nenyo nekilen exceptional technology, extraordinary care. Ko en exceptional technology kuya kairo theater nenyo, theaters kitindoi theaters oeng chetindoi equipments chebo kisasa chetoreti daktariek yo inyoi biik chemiondos. Kitindoi kora ICU netindoi kitandok 12 chekimuchi ketorete biik chemoche services chebo ICU. Kitindoi wards cheimuchi en kasar agenge komuchi kitindoi kitandok 100. So kitindoi general ward, kitindoi children ward anan ko pediatrics ward, kitindoi male ward, kitindoi private anan ko executive wards. Ako kora oin yemalo ko kiketou maternity wing nebo kamasta nebo kwonyik chemoche kotum, ketindoi maternity ward. www.tophillhospital.com. Imuchi ibuken appointment en yotok ngot ko memuchi ibiru simet anan ko inyo ibukeni appointment through the website. Komi staff nekikende standby, inyor kityo that appointment. Ngo kwaeng kasi ngo somok kasi inyoni kityo kiitu kokakereservanun inyoru daktari betunotok through the website. Simet ne imuchi inyorwech en oret ne nyumnyum ko 0782 12 12 14. Top Hill Hospital 0782 12 12 14 en oretab simet.
So causes of the major cause nebo problems about joints ak bones ko trauma ko kakayumian chito either from a fall, road accident or maybe assault. So the commonest cause even like generally ko trauma. Two other causes ko degenerative changes in jointit. En jointit ngotestai koetu chito kotestai there is wear and tear in the joint because of a lot of movement. Ko ngotestai with that wear and tear ko imuche kwamak jointit ake komakomuche kotamove kou yekiu. So that's another cause. Alak kora ko there are issues called autoimmune disorders, some of these rheumatoid arthritis ko tuguk chebwone, it's because of the body's response. Kokenget komi en cancers, so miten kora cancers chebo bones, cancers chebo muscles, ak cancers che affecteni say breast cancer sometimes komuche koba kowek akomuch koil kowet because of those. Alak ko amitwogik kora chekiame en chito nematinye enough adequate calcium ak vitamin D komuche konyor cortical rickets akomuch koile kowet rahisi. The leading cause fractures ko trauma. Abakora like more than 80% go trauma. And the major cause of trauma for mostly road traffic accidents. Either go carries and go of late we are seeing a lot of accidents about big. En chitukul what is tam ginete big sana ko the kitinye chekuren ABCD. So in ABCDE. So en chito yon for first aid ko inamen korok assessment airway ko I make sure ile ubuse chito. So amun kit netai nemuche kobar chito ko mabuse. So kit netai nemuche iyai ko I make sure ile buse. So some of the simple ni ko either chin lift maneuver and go jaw thrust and go chin lift maneuver. So komuch koyat again the airway. Oeng ko make sure ile tinye circulation muche kobus, so that's A and B. Nebo somok ko circulation and cervical spine mobilization. So en chito ne mara katinye bleeding komuche ko bleed enter ko mami korotik cheyomotin ko circulated. So another one ko nanda you make sure there is circulation and you stop the bleeding. Then D ko assessment of any other disability, and E ko for exposure, adequate exposure. So that is the first aid kinete biik abakora en chito nekenyoru chito kotinye in case of any trauma. So those are the first steps che muche itaken as a first aider. So kineta ko keinamen choto the assessment, the primary survey kai make sure ile muche kobusa kotesta kopire muguleldo. Ko netai yon itinye chito netinye fracture, kineta ko minimal handling ak kemuch ke supporten yekami the fracture. So ke supporten ko kimuche ot irotyi kit neu bakoiyot anan ko bokisit, something stiff to make sure it is immobilized. So that is the first step ko stoppen if there is any bleeding. Then after that ko imuche with that mobilization imuche transporten a bigger center imuche kosich surgical expertise ak imuche keyachi operation ke correcta. So abakora amun most of these accidents kekertoi abakora ko pikipiki. So kinde mi ko mache kinet kora biik chekete pikipiki about safe driving. Amun the major cause it's because of poor ways of driving. Kinet biik akobo proper road sign, proper road etiquette. Makiet overtaken ovyo. Make sure your vehicle ama pikipiki tinye all the necessary fixtures so that it's roadworthy. Konoto abakora ak chito ne kosiche biik that refresher course ngoyae kokete kongen kotinye that updated knowledge in driving. So arthritis go any wear and tear or any damage inside the joint. So and where the commonest you hear about trauma still. Some of the trauma arthritis the major cause go traumatic. Now with wear and tear ko non kiko teseta amun joint it ko gina move ne very mobile. So got mucho konyor those wear and tear chebwana kenyisiek. Now, so that is another common cause. Now, yekimuche keripto, of course, kitinye kora, mi kora infections inside the joint. So infections komuche ko TB, imuche ko typhoid infection, imuche ko any bacterial infection, or even sometimes you can have we call it pyogenic. It's basically bacterial infection. Nagako in pururutek in joint itory. So that is an infection. Then another cause ko autoimmune. Autoimmune ko kinemi probably in the it's a familial thing. Ko mucho ko the body, it produces antibodies that are attacking the joint lining. So you get autoimmune arthritis. For risk factors, I think apart from the genetic, the others of course would be most not even risk factors. They would be more of causes, go trauma and go infection. But when you come to autoimmune, the risk factor is that familial predisposition. So then maybe especially in rheumatoid arthritis, it runs in the family, the gene runs in the family. Then affect especially the female lineage, so it is more predisposed, the females are more predisposed to rheumatoid arthritis. In any arthritis, yakakimuch kisip kenyor kotoma ko affecten joint saite. It's a simple like a simple management, anti-inflammatory medication, ibuprofen, meloxicam, diclofenac. Ko chon ko kerichek chekimuche keboisien so pose the inflammation nemiten en joint inata akomuch ko stoppen the disease from progressing. So it's very important kesip kenam kotomo kwam joint. Yekakwam joint now you'll need a surgical option the moment the joint has been destroyed. Komami away kerichek chemuche indet sikowek a joint nekakwamak kobek. Yeah, so kerichek is very important. Yes, in arthritis, there are those symptoms. So the symptoms about joint pains, but mostly pain in the joint, stiffness, and then that because it's south you're moving the joint. So that tells you there is a problem coming. But mostly, when you get any pain, pain is a very important protective mechanism in our bodies. When you get any pain, you can investigate and that joint as well. The problem is. So go to blood test, go rheumatoid factor, ESR, that's erythrocyte sedimentation rate. Uzito nebo korotik ko ngomi uzito komi barak ESR koboru kole there is an inflammatory reaction going on. What we call anti-citrullinated peptide komuche kora that is specific to the joint. C-reactive protein those are chonda tugul ko cheboru kole mi an inflammatory process netesta. Kongesip kenai kokainai ile that this joint is being affected by inflammation. Kinomchi kerichek to address the inflammation. So the surgical procedures kotienge yekakoit the disease and the cause. Kou infection and akomi pururutek en joint. Kit nekiyoe ko arthrotomy ak ketil keyat joint inoto asikisto pururutek choto. So that's a surgical procedure en eunono. Now for others, kou joint kikwamak kobek nemakomuche takomove. So replace in that way, kinde kityo chumayot ko replace. So kinde chumayot on both sides where the ball and the socket, kinde komi implants chekimuche kinde ko replace joint inoto. Akomuch kotembean chito kou yekotam kou before the inflammation. Other modalities go to physiotherapy, amun kora ngeyachi chito mazoezi komuche kotoret kora ko replace that joint. Ak kerichek kokakimwa either supplements and anti-inflammatory medication. So it will depend on the cause. kotko chito nekisuspecten kele tinye familial predisposition to arthritis ko tor komoche that monitoring ak isib kinomchi kerichek and mostly komaat kerichek chebo ngwonindo kinomchin anti-inflammatory medication anan ko bones joint lining supplements kebare glucosamine kotor kotinye sikotinye that good replacement of the joint lining konoto komuche kotoret sima progress and the disease koit koloet alak ko the anti-inflammatories ko kimuche kinamen the lowest level of anti-inflammatory chemuche kityo kidogo sikomuch kobos komatesta mazoezi koyoe chito mazoezi ngobur jointit for long komuche koek stiff so komoe keyochi mazoezi abakora tuguk cheu splinting yon jointit nekako affecten kimuche kemobilizen for some time so kindo splint sikosupporten maybe for a few weeks then it reduces pain and the inflammation in jointit noto amun jointit nekako any continued movement will cause more inflammation so kemobilizen kotoret for some time na ako kit ne important saiti ko tuguk chemuche ko replacen the joint lining so one supplement chetinye mostly vitamin B complex. The vitamin B complex is very important. Tuguk cheu vitamin D. Vitamin D is good for the development, a good development of the bone. Ak tuguk cheu calcium. So en amitwogik kotko mi tuguk cheu chego, they are very important in disorders che affect the bone and the joint. So en chito nekere ko kit ne important ko kerib kora our joints. Apa kora na ikere like the kind of activities che kiyoe. So there is a specific way of doing everything. Yan muche kou jointit mamache ke overworken amamache mache kora keyoe mazoezi a moderate amount of exercise. So the usual activities. Tuguk cheu abnormal posturing kou en jointishek chebo spine ak the pelvis ko abakora ko amun because of our posturing yon keyoe activities mara you are lifting an object, you are lifting in an improper manner, so those are the things that tend to affect the joints and the muscles and the ligaments to support them. Amitwogik kora kerib amitwogik chekiame sikomuch ko replace the lining, that joint lining akomuch kobos kora the amount of wear and tear. Nyolu kinet biik kora konai kole surgery is a safe option. Daktari chekitinye we have people specialists chekikitrainen over years. People have trained for these surgeries. So ngomwoe daktari kole kimoe keon operation, there must be a good reason. Kama komwoe kityo kere kole kini. It's because the joint has worn out or muche takotesta. So the moment iteseta, you are just continuing to suffer. Replace, and these procedures cover in your NHIF. Sometimes you don't have to pay anything. There is enough expertise in Kenya to address these issues. Nowadays, I just in India or Germany for joint replacement. And within 2 days, because these are because of the expertise. So you got to match operation. Kityo mpango keoun solve that problem any other. So sport related injuries are common, especially among sport is a very we can say violent activity. So these are the significant percentage of athletes or football players will tend to suffer injuries. Commonest, of course, could be tienge sport ne chita. For people who run, of course, they tend to get more of lower limb injuries. Now, the commonest injuries, mostly it's on the ligaments and the ligaments and the tendons. Ligaments and tendons, which support in your muscles, to the bone. So any violent activity sometimes imuche konget anan kotutkei en the attachment to the joint. Alak kora especially in volleyballers and tennis ball players kosiche injuries on the hands. So injuries on the hands, they will be still ligaments and tendons, and large percentage will also tend to get small fractures in joint and in bones to engage by. So it's a significant injury and affecting that specific group. Now, the specialists, their specialty goes sport injuries, orthopedic surgeons, we have sports physicians, che mucho ko address these injuries. About these injuries, sana go mucho kosta chita in from the play for quite some significant time. Go kigera our athletes. Sometimes they have to take a whole season of amount of these injuries. So they are quite a significant cause of morbidity.